Greetings. This is the third video in my series of practical or common sense neurology, and today's topic is geared more towards nursing staff in that I'm going to discuss delirium. Well, what is delirium? Delirium is simply an acute change in the level or content of consciousness of an individual. This is in contrast to dementia, which is a chronic cognitive impairment, usually severe enough to cause some degree of occupational or social functioning. Anyone can become delirious provided the right stressor or stimulus. Say, an otherwise healthy person could become delirious if given PCP, though that threshold is much lower for a demented patient. And that's why you see delirium much more commonly amongst demented individuals. Why is that? Well, with dementia, one or two things are happening with your brain. One, your neurons aren't functioning normally, or they're unable to communicate with each other normally. Usually both of these factors are at play. This means that the degree of stimulus necessary to make somebody delirious is much lower if you are demented than otherwise mentating normally. This causes a great deal of consternation because sometimes the stimulus is so minute that it's not something that we can measure with a lumbar puncture or an imaging study or any kind of blood work. This is why when you see your delirious patients who suffer from a moderate or severe dementia usually have an unremarkable workup. This shouldn't be too surprising because the concept of sundowning itself implies some degree of dysfunction from the circadian rhythm in demented patients. So it would follow that it's not necessarily the case that something must be found every time something is wrong. And that's really all I wanted to discuss right now. If you have any further questions, please don't hesitate to ask. And if you like what I'm producing, please don't hesitate to like, comment, or subscribe. Thank you very much.